Let's bust some of the COVID spin that is around tonight. Now, the Prime Minister has made this very clear for more than a year. We should not judge the exposure sites. We should not judge the spread of COVID on case numbers alone. Put simply, remember flattening the curve when everyone was sent to their room last year and multiple times in the past few months? Well, all of that was about our hospital system. And it is still the hospital system that is the ultimate reason whether there needs to be lockdowns or not. The Prime Minister will tell you in a few minutes' time about just how many people are in ICU tonight.
Right now, there is not one person in an ICU with COVID. Not one. Now, that's not the case in so many other parts of the world.
Not one person. Yet, everyone from New South Wales, regardless of whether they are hundreds of kilometres away in regional New South Wales, they're not allowed to travel to Western Australia because of the idiot emperor over there. Queen Palaszczuk here in Queensland, well, she's messed the bed, of course, about the idea of anything happening when it comes to people coming from regional New South Wales, as well as the garbage that she's been willing to cover up in her own government's handling, where 3 cases popped up today. But again, the Prime Minister is trying to put some things back into perspective. That again, it is not about the number of exposure sites, which celebrity hairdresser people went to, whether or not there's some special strain running around in the New South Wales Parliament. It's about the number of people who get truly sick from this thing.
What is important now is in those countries where they do have a lot of cases, but what they're tracking is what's happening with hospitalisations. And that's one of the principal reasons why Boris Johnson extended out the restrictions that he had, because they were seeing those hospitalisation rates rise again, and that was off the back of the new variant. So this thing keeps changing, and you've got to work out what you're trying to manage.
So there's no one in ICU. How many people are in hospital in New South Wales? 2. That's it. All of what's going on right now, 2 people are in hospital. But it doesn't stop the fear porn, it doesn't stop the scaremongering, and the media all day, every day, keep feeding people this garbage. Take your pick. Is it 400,000 people who might have been exposed to COVID? Because that's what the sewer tests have said. Is it in the air you breathe, like they tried to tell you in the Turnbull Times today? Is it the scariest period New South Wales has ever gone through, according to the Channel 9 media today? Well, the Premier of New South Wales herself spoke about all of those new cases that you've heard about in the past 24 hours.
So in total, there have been 11 new cases since we last updated the community. Pleasingly, all but 1 are linked.
Good news, right? The very next sentence the Premier said, when there was an opportunity to calm people down, she revved people up.
Since the pandemic has started, this is perhaps the scariest period that New South Wales is going through.
Oh, fair dinkum. All right, so tonight, there are 47 new cases in the past 8 days in New South Wales. There have been 242,861 people that have been tested for the super scary Delta Force strain of definitely not the China virus, okay? Since this started, if you take 242,000 people who've been tested, 47 cases that are positive, it's 0.01% of everyone who's been tested who has COVID. That has not changed since yesterday. It was exactly the same rate that was ripping through Melbourne when it was a beast a few weeks ago. So let's deal with some of these myths here. It is not all over Sydney, because Sydney has a grand total of 35 council areas, and there are active cases in 12 of them. Ooh, scary. But here's the thing. Just 3 of the 35 cases in all of Sydney, not all of New South Wales, all of Sydney, have more than 5 cases. Waverley, in the east, that's Bondi, 12 cases. They're all linked. The central Sydney, 5, Wollongong, 5. That's it. Yet, unbelievably, the majority of people who responded to a poll at news.com.au today who live in Sydney want Sydney locked down. Seriously. All those numbers I just told you, 0.01% of everyone who has been to any of the sites, knows any of the people, gets a sniffle or maybe just wants a day off. All of those people, it produced virtually no cases. Not a zero, but virtually no cases. 39% of people who responded to the poll live in Sydney, say lockdown Sydney. 3 council areas of 35 have more than 5 cases. 24% of people have sanity in Sydney and don't want a lockdown. 10% of people in Melbourne say, sure, at least it's not us. And 4% of people in Melbourne say, no, lockdowns aren't the answer. So unbelievable here again. Should Sydney have a snap lockdown? Because of the diet of fear being fed to the people of wider Australia by premiers who want to keep you scared to keep their jobs. 17% of people who live interstate want a lockdown for Sydney. 6% don't. So again, tonight and every night, you come to me because I tell you straight. We have a chat, and we have for more than 10 years now, where I will call through the BS and I'll tell you what's really going on. Now, unbelievably, there was a media organisation who put out some data today that helps me siphon through the BS. And are you sitting down? It was Channel 2. I know. They put this story up on their taxpayer-funded website, which basically compared how does the Bondi cluster go to last year's outbreaks, particularly in New South Wales. Today is day 9 of the Bondi cluster, same day of the Avalon cluster, which was the Northern Beaches at the end of last year. They had 119 cases. 119 cases, and they just locked down 1 council area. There's not even 50, and there are people who want to lock down all of Sydney right now. And way back when, at the start of all of this, 51 cases was at the Crossroads Hotel, where they didn't even shut down the street, let alone the suburb or anything else. So, COVID is not all over Sydney right now. Are there lots of people getting tested? Good. But the idea that you have to scare people into getting tested in order to get more data every day, that there is no difference day to day, and that this is not racing faster than previous outbreaks, that's a disgrace. But fear is easy. It's easy for the media, and it is way too easy for politicians. Now, let's bust through some more hype here. Now, if you believe many on the left, and many you might argue within your family, the assumption is that there's not enough vaccine floating around in the country right now for all the people who want to get the vaccine. This is a line that Anthony Albanese thinks he can push very hard all the way to unseating the government at the next election. Here was how he carried on today.
They have to fix up the vaccine and the quarantine. They have to fix up those things. And this government have, quite frankly, botched both.
Now, there's a dangerous game being played here by Each Way Albo, but does that surprise you? You should always think poorly of people who are willing to take the lowest road to the highest office. He is deliberately trying to confuse the responsibility of federal and state government. And people are busy. They half pay attention to things. They may see that grab on the 6 p.m. news rather than what I'm saying right now on Sky News, either on Foxtel Win or on the many people who watch us on YouTube. That's why you've got to share these videos amongst your friends, because all of this is based in the facts and data. All of this stuff has been sourced from the official data. But here's the truth. For whatever reason, people don't want to get the vaccine at the moment. It's your choice to do so. But I want you to have a look at this. Because if you go online, you can find websites that will help book you into places where you can get the vaccine. In Albo's world, there's not enough vaccine, but everyone wants to get the vaccine tomorrow. We'll have a look right now at the available appointments at just 1 doctor's office in central Sydney. You can get one about every 5 minutes, between 10 o'clock in the morning and 5:30 tomorrow. In Melbourne, from 8 o'clock in the morning till 5 minutes to midnight, you can get the vaccine in Melbourne if you want it. In Brisbane, tomorrow, 1 doctor's office in the centre of Brisbane, from 9 o'clock in the morning till lunchtime, till the afternoon, and when happy hour begins, you can get the vaccine if you want to get the vaccine. The truth is that Australians are hesitant to get the vaccine, and why wouldn't you be when The information you have received from government at times has been grossly contradictory. But equally, as I said last night, when there's no benefit to getting the vaccine when it comes to being able to cross borders, being able to see relatives, until state government leaders start making those promises, then people aren't going to get vaccinated. It's a bigger issue than issues to do with AstraZeneca. Now, thankfully, as we've heard in the past couple of days, if AstraZeneca is the problem, well, that supply will be slowly pushed down for the next couple of months, and then in October, if you want to, in all age groups, you can go into Pfizer. But there seems like there are two realities when it comes to vaccine rollout right now. There's the game that one part of Australia wants people to think that every single person is lined up around the block and they want to get the vaccine. And then there is the reality that there are spot after spot after spot after spot after spot every 5 minutes in Sydney, Melbourne and Brisbane tomorrow, but people don't want to get the vaccine. Again, if you choose to, your business. But until you're given an incentive to, it's hard to explain to people why it needs to happen. When our state premiers freak out about 5 cases, if they shut down people that are thousands of kilometres away, then eventually the assumption of most people is the virus will end up nowhere near them. Another COVID myth that we need to bust. There is a rule for them and there is a rule for us. Now, New South Wales Parliament was in a bit of a tiz today because one of its members has tested positive. Now, what is quite amazing about this is that essentially anyone who works in the New South Wales Parliament has been told they have to go to their room for the next 14 days, regardless of whether they have the virus or not. There are entire parts of the media who have been told to go home, despite the fact they probably don't have the virus, because the one bloke who does have it apparently walked past their door. This is despite the fact that, remember, 0.01% of everyone who's got tested, it ain't screaming through the halls the way that it's being made out. But why do I say there's one rule for one and one rule for the other? You see, basically, if you're just part of the machine in Parliament House, if you're a security guard, if you're a cook, you have to go home for the next 2 weeks. If you're the Premier of New South Wales and you've been in the same dining room or the same Parliament or the same office floor as this bloke, oh no, you don't have to go for 14 days because, of course, it's the science, right? Have a look at this.
I was interviewed by Health. Health has made their assessments and deemed that I'm a casual contact. I was tested very early this morning and isolated and returned a negative test a couple of hours ago, and I will continue to follow health advice.
But the whole point is that everyone else who would have a negative test in the next 14 days can't leave their house? What is the special magical power that the people who run this joint think that they have? Like the Premier of Queensland, who got a different version of the vaccine than anyone else would be able to get in this room. Why? Because she's going to the Olympics? Obviously to watch, not compete. Now, also on top of all of this is that the New South Wales government, the whole reason all of this started again was because there was a bloke who was a driver who was driving flight crews from Sydney Airport. That's apparently how he caught it. Now, amazingly, this bloke was not vaccinated. So he's public enemy number one, not just in Sydney, but around the whole country. And here is the gold standard government, who I normally are on the side of, still making a scapegoat of this bloke.
All workers, all drivers within the quarantine system have very strict obligations which are covered in our health orders. And if there's been any breach of that compliance, the police will advise us of that. But we also have to appreciate that no system is perfect.
Not true. As Andrew Clennell has been reporting here on Sky News, the health orders that covered the driver have not been updated. The driver doesn't have to be vaccinated under those health orders. So the driver who should have been vaccinated was allowed not to be vaccinated because of the rules the New South Wales government put in place. The New South Wales government, as opposed to accepting their own failure, just like Ruby Princess, have now turned around and said, oh, no, it's still the driver's fault. They are the gold standard when it comes to proportionality, avoiding lockdowns, contact tracing. But today they get the gold standard for spin. And finally, just on the virus, because I'm as sick of it as you are, and we're going to party here in Gladstone tonight, and we'll have a chat with the PM in a second, right? Stop panic buying. I hate to put this any other way, but there is no other way to put it. COVID doesn't affect that end of the body, okay? I don't know why people keep buying toilet paper a year and a bit in, but even with Sydney on whatever the heck it's going through right now, people are still stacking up on the toilet paper. People, please, stop reminding us of the downside of compulsory voting.